Welcome and thank you for visiting my website. I am Dr. Elliot Davis. Please allow me to share what makes my unique approach to dentistry and healthcare so innovative and effective. I know you had a sneak peek at the photos, but you really have to see it and hear all about it to believe it. Have I come up with a cure for periodontal disease? Well, let me show you what arch reformulation therapy can accomplish in a remarkably natural way, and I'll let you decide. She's 81 years old. She hemmed and hawed for more than 2 years before she finally decided to go ahead and start treatment. Not much difference. Maybe a little wider smile. Maybe some more teeth are showing. Let's look inside her mouth and check out her bite. She's 81. Notice the buildup of the plaque and the film on the lower front teeth. It's not from a lack of oral hygiene. She brushes her teeth 2 to 3 times each day, and she's a flosser. Notice in less than a year, the amount of buildup is greatly reduced. So what stands out? Look at how much cleaner her mouth and gums have become. We refer to this as gum health level 1 being achieved. The bottom photo is about 1 year into her treatment. Look at the yellow lines between her top 2 front teeth and her top 2 bottom teeth. Most of the midline discrepancy has already been corrected. Look at the arrows pointing to the right. In the 1 year photo on the bottom, it's pointing to a black space. As the mouth is naturally adding new bone, it's also becoming wider, and the teeth are being kept clear of each other so they won't impede the progress. The arrows pointing up, that's highlighting just how much less buildup is accumulating. During the next phase of care, the gums and the bite are both expected to continue to improve. Let's now look at her bottom jaw. This is a bird's eye view of her lower jaw just before we started treatment. The teeth are collapsing towards the tongue and are keeping the canines from joining the rest. How bad was her buildup? If I cleaned her teeth on Monday, by Friday she'd be ready for another cleaning. It really was that bad. Now, this is an arch form, much closer to the ideal. It's now clear why her mouth is so much cleaner. It's not because she bought a new toothbrush or changed toothpaste brands. It had nothing to do with her oral hygiene. What toothbrush do you think is designed to fit in here anyway? Her teeth were so severely crowded, they were leaning over and pointing in towards the tongue. The fronts, they were accumulating plenty of plaque. And the back of these teeth, they were not only collecting plaque, it was forming hard, stubborn, difficult to remove calculus. Now that each tooth is standing upright and has enough room, we can clearly see the difference. When all the teeth are in their proper position, the mouth will be self-cleansing. Before, her mouth was sort of self-dirtying. I'm not even sure if that's a word. But I do know that a lot of plaque, bacteria, and stain were being trapped and kept there on her teeth and gums. So what treatment did she have? She had sequential clear aligners. In this case, she had Invislign, which were designed in accordance with the arch reformulation therapy protocol. There was a significant improvement in the health of the gums without any need for a gum treatment. When I claim that providing special dentistry is my specialty, this is the perfect example. It is such a privilege and so exciting to be able to have someone's mouth become so much healthier in such a conservative and cost-effective manner. I invite you to enjoy some other patient videos with equally compelling stories. Once again, thank you for taking your valuable time to view this. I am Dr. Elliot Davis. Please stay well.